Good afternoon, class. Our presentation is on vascular interventional procedures. I'm going to start by explaining what vascular interventional radiology is. Basically, it is any selective catheter or needle technique used for the diagnosis and treatment of a disease in blood vessels. It is a minimally invasive procedure that uses local or intravenous sedation. This procedure is also known as image-guided surgery. It is guided by radiological imaging such as fluoroscopy, CT, or ultrasound. The images taken are used to direct interventional procedures that are done with needles and catheters, and it helps the radiologist guide catheters and needles through the body to the areas of the disease. Vascular interventional procedures, or vascular interventional radiology, encompasses a wide range of procedures. The major divisions of vascular interventional radiology are procedures used to decrease or stop blood flow. Those procedures used to increase blood flow, and interventions used to remove foreign bodies from the vascular system. Here are some of the procedures used to decrease blood flow. They include transcatheter embolization, intravascular electrocoagulation, infusion of vasoconstrictors, mechanical methods, and some catheter balloon techniques as well. I'm going to briefly describe some of the procedures done to decrease blood flow. The first one is transcatheter embolization, and this procedure is indicated in cases of post-traumatic hemorrhage and for reduction of bleeding during and after surgical procedures. This is indicated in high-risk cases. It is accomplished by the process of closing off or obstructing the inside of blood vessels by placing a foreign substance into the lumen of a selected vessel through a catheter. Intravenous electrocoagulation is another process and is indicated in cases of diagnosed tumors, hemangioma, and arteriovenous fistulas. This method produces a thrombus in the vessel as a result of the application of a direct electric current. And another procedure is intravascular infusion of vasoconstrictors. This procedure is indicated in cases of suspected upper gastrointestinal bleeding, and it is accomplished by the slow infusion of vasoconstrictors into a vessel through a catheter for the control of bleeding. The slow infusion of vasoconstrictors into the vessels through a catheter is a useful therapeutic technique for the control of bleeding. Vasoconstrictors cause contraction of the muscles associated with the arteries and capillaries, resulting in an increase in the resistance of the flow of blood with a corresponding increase in blood pressure. One of the procedures that is commonly done for the decrease of blood is uterine artery embolization. This procedure is done to treat fibroids in the uterine for women. This is an invasive means of blocking the arteries that supply blood to the fibroids. It is a procedure that uses angiography to place a catheter into the uterine arteries. The small particles are injected into arteries, which results in their blockage. This technique is essentially the same as that used to control bleeding that occurs after childbirth or pelvic fracture or bleeding caused by malignant tumors. And we have a video that shows how this procedure works. I hope it plays. There's no sound to this video, so I'm just going to explain. So I'm just going to explain what it's doing. Okay, that's a female. And this is the uterine wall. That's the fibroid right there, and these are the arteries that supply the fibroid with blood. And as the fibroid is being supplied with blood, it gets bigger and bigger and bigger. And yeah, and this is a catheter. I don't know if you guys can see. This is a catheter being inserted through the femoral artery into the uterine artery to the vessels that supply the fibroid, and it supplies embolic agents to the arteries that block the blood. They're injected into the arteries, which results in their blockage. And these particles are going into the fibroid arteries, not the uterus. And when I don't know who that is. And so when the blood gets blocked, it kills the fibroid and it shrinks. So that's how they get rid of the fibroids in the uterine wall of the uterus. So there it's gone. So that's how this procedure works. And this is a picture that shows you how the catheter is inserted into the femoral artery, into the uterine artery, to the fibroid, and releases the particles and kills the fibroid.
I'll be talking about the increasing blood flow procedures that are done in vascular intervention cardiology. We have intravascular thrombolysis, intra-arterial infusion of vascular dilators. You have percutaneous transluminary angioplasty, which is also PTA. You have vascular stent placement, dilation of stenotic artery, recanalization of occluded artery, laser angioplasty, removal of embolus, and arrhythmic indications for taking fluids to increase blood flow. Intravascular thrombosis is indicated to treat arterial thromboemboli by introducing specific thrombolytic agents intravenously. Infusion of vasodilators is indicated in cases of vessel spasms or constrictions. Percutaneous transluminary angioplasty is indicated to treat stenotic arterial disease, primary and medium large size vessels. Percutaneous transluminary angioplasty encompasses dilation and recanalization by getting into blood vessel through a puncture in the skin and reshaping or repairing inside the diameter of the blood vessel through a balloon inflation. Disadvantage of PTA is the weakening of the vessel wall due to pressure if the balloon expansion. To reduce these negative aspects, the use of intravascular stents provides a method of maintaining the dimensions of the vessel lumen. This is an example of a femoral arterial angioplasty. This is how it's blocked. It shows how it's blocked before they do the examination. This is after they insert the stent. It shows how the blockage is unblocked.